So when it comes to autism, we think only in terms of the first 3 years of life. That it first begins to manifest maybe when you're 2 years of age or when you're 3 years of age. But the truth is the foundation for autism started way, 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 way back. Some say within the first trimester, specifically between days 20 and 24. And there appears to be some kind of insult to the developing brain. Now, the brain, as you know, is extremely sensitive. So it's really important that we understand what's going on so we can better prepare our mothers or our mothers to be so that they can take the necessary precautions. So some of the things that we know can cause a factor are nutrient deficiencies. For instance, folic acid deficiencies. We know that the mother's immune system could go haywire and attack the developing brain and cause deficiencies there. We also know that toxins like heavy metals, let's say the mother worked in a dental office for a long time and she was inhaling all the fumes from the use of those chemicals. Well, that could get into her blood and therefore could affect the developing brain. Another thing that could happen, of course, are the chemicals, heavy metals. These are chemicals that maybe people stay in a polluted area, like people who they found out that people who live in mining areas or where there are quarries, where there's a lot of mining going on, they find out that there's a higher incidence of autism around those areas. So you have to remember the brain is extremely sensitive. So autism seems to be like a catch-all phrase, basically referring to so many different conditions. Basically, the point is the three main issues: lack of social development, lack of speech or deficiency in speech, and on different behaviors, unusual behaviors. So that's a trio of autism. And again, it's many times you don't really have what is known as classical autism. Many times you just see those three things and they just label them as autism. So we said chemicals, we've talked about immune deficiencies, immune attack by the mother, heavy metals, nutrient deficiencies. There are one or two that I don't know why I keep on forgetting. So things from the gut. So bacteria or viruses. There's a big movement. There's a doctor called Michael Goldberg in the US who deals a lot with viruses, saying that viruses are the cause of many of these autistic conditions. The truth is that any of these things, whether viruses, bacteria, even worms, believe it or not, can have an effect on the developing brain. Maybe not just the worms, it could even be the offspring of the worms or the bacteria that get into the bloodstream and attack the brain. So there are all kinds of agents, biological, chemical, physical agents that can cause autism right from the first few years of birth. So it's really, really important that we educate, especially pediatricians, gynecologists, and of course mothers-to-be about the things that they can do to help protect themselves. One of the key things you want to make sure that mothers have: vitamin C, vitamin D. Very, very important that their blood levels are maximized, optimized of those nutrients. So that's it for now, and we'll continue later.